All right, so I'll pass it off to Governor McKee.
Yeah, thanks, Chris, and thanks to the team here. I think that, in terms of the vaccination program, the general certainly can weigh in on the work that's going on there. That's been great, and the teachers and the childcare will be announced tomorrow with a plan that will, in essence, will begin that process, and we'll go over that timetable tomorrow as it's being developed. But I think that's going to be an added plus to the effort. But you got, and I think the generals told me we're over 90%, 75 and older right now. I think that we're creeping towards the mid 60s on the 65 and older, and there's plans to open up to 60 to 64 shortly with people with conditions, right? Some medical conditions in terms of at-risk type of people. So I think that all in all, we're in motion, and we're actually starting to really think seriously, not only about the schools, but also about the reopening the economy. But I'd like to hear, Dr. Jacques, points on these things, but we're still kind of like making sure that this variant is not there. So we're looking at, another week of really looking closely. A lot of the states are being a lot more aggressive right now, but I think that our strategy has been this incremental advancement but continuously. And I think Friday there'll be more incremental flexibility, as I've been calling it, for our business community. So, and then yes, so we're day 6. Just let everybody know on the call. We're day 6, and here we go. And I'm gonna just keep on counting to the top day 100, and we appreciate all the input. But as we shift, there is going to be a shift going if we're still successful on, as we have with Dr. Alexander Scott, the general and others that are working on this infection rates and hospitalization rates and as well as mortality rates. So we'll keep on the pace that we're on right now. I can kind of see the, very strong move to hope open up the economy. So that's my update, Chris. Thanks.
Thank you very much, Governor. And also wanted to welcome, I forgot to welcome our esteemed members of the media who are on the call as well. Welcome you. Thank you for being here. And so I'll pass it off to Mayor Policina. Thank you very much, Mayor.
Thank you, Chris, and hello to all my colleagues on this committee. It's a very important committee, as you all are well aware, and I thank you for your time that you've dedicated for the people of Rhode Island, and of course for Governor McKee. Just a couple of things. I know the governor's a little bit modest in what he's doing out there, but I want everyone to know that his priority, he has a lot of priorities with this COVID vaccine, and of course the priority is to make sure that Rhode Islanders get the vaccine and we get back to business, so to speak. So getting the vaccines out of inventory into the people's arms of our fellow citizens is top priority for Governor McKee. And of course, increasing the capacity. So when the vaccine supply increases, we're ready to go. We've got our firefighters ready on a moment's notice if they have to start giving vaccines. If we have to open up more regional pods or local pods, that will be done. And of course, the governor's priority is supporting communities, obviously, as we merge into municipal vaccine sites, strategic regions and sites. We want to make sure that we don't miss any population, make sure that all 39 cities and towns, those citizens are cared for and taken care of. And of course, opening additional sites is important to the governor to meet the additional needs for all Rhode Islanders who want to get want to get the shots, excuse me. Also, Governor McKee is very big on engaging all 39 cities and towns, including their faith leaders, elected officials, business owners, and community activists to combat the vaccine hesitance. There is some hesitance, and with rumors out there, the old he said, she said rumors, and spread the word that the vaccines are safe and they do save lives, especially in the communities of color. So these are a few things that the Governor McKee is looking to do. And of course, the governor doesn't look tired though. He looks great. I'm surprised, but he's working round the clock, I have to say it, to get the shots in the arms of teachers. That was one of his priorities also, is to get the students back in the classrooms and of course get businesses back in business. So obviously at his 6 days, he's done a lot in the past 6 days, and he's got, as I said, he's on the road to moving and making sure that Rhode Islanders are safe. So with that said, I want to thank once again all of you that are on this committee. It's a very, very, very important committee. This committee obviously is going to make some decisions that is going to save the lives of our brothers and sisters in Rhode Island. So I thank you. With that said, I want to introduce someone who has been really on the edge, if you will, of COVID vaccinating. And of course, that's Dr. Stoukidis. Dr. Stoukidis, I just saw your picture and I saw your photo. Are you around? I was talking to you earlier.
Yep, I'm here.
Hi, Doc. Thank you.
Yeah,
Thank you.
thanks, Joe. My plan was to summarize. We had a vaccine distribution subcommittee that's met, and there's a number of recommendations that have come up from the vaccine subcommittee that are worth some consideration. First was, focusing on what we've already been doing that's really, I think, helped drive us from such low rankings in our vaccine distribution to higher is really looking at, local distribution of vaccine, trying to get the local brick and mortar places up and running to multiple different forms of vaccine clinics to try to keep that community engagement going and get people vaccinated. Focusing on schools, on different areas in the community where we can get vaccine distribution moving. Getting to a point that demand is driving supply, and that's more of a national level, but it's definitely getting there. Some other thoughts that people brought up were making sure that we engage the primary care physician community to start getting involved with vaccination. That's going to take some logistics changes because the primary care physician community doesn't have the ability to store vaccine. We need to look at our distribution network that we have. We have a very limited distribution network right now where vaccines stored and shipped thawed. How can we get more people and more sites involved in distribution to get out to the primary care docs and get them the vaccines they need so they can start immunizing their patients, doing clinics in their offices will be helpful. Planning on, all this kind of ties into the fact that we've got to plan on what are we going to do when we have a significant increase in supply, and how can we not stall when this supply occurs. We want to be able to, the minute we get extra vaccine, be able to roll out extra vaccine. And with that, one of the committee members brought up the fact that we should develop a more open process for reporting available vaccine supply. How do we get it out there? More transparent setup to advertise how many doses are in the state, how many doses are being distributed today, how many have not been given so far, so people have a good idea of what's been happening with the vaccine distribution. And the other thing was looking at the type of vaccine and who gets it distributed to who. Now with the availability of the Johnson & Johnson vaccine, that opens up the ability for a lot of different sites that would benefit from this type of vaccine. For example, hospitals, emergency rooms can start giving vaccine if they don't have to worry about follow-up vaccine. Same thing with hospital discharges. Also home care agencies to be able to reach out and start being able to administer vaccines, single dose vaccines at home without having to do prolonged monitoring that's not required with the new vaccines that are with the J&J vaccine. And I think that pretty much wraps up a number of the key points that were in the vaccine distribution subcommittee. I don't know if we have any of the other members who have any other input from what I summarized of your points, or I see a few of you are on here, so.
Doctor, I'd like to talk about the transparency issue just real quick. I'm the one that brought that up. The Department of Health has all kinds of figures out there. And as we try and advertise and get people to get this vaccination, I think it's extremely important that we build confidence in the public that the vaccine's here in the state, that it's being utilized appropriately. And it seems to me that it's very easy to do something very similar to what they do with the COVID statistics every day and just list, here's how many are in the state, here's where they are, here's how many were administered. And it'll just be a more transparent process to the people and bring beat back any doubt that people might have about the validity of what we're trying to do.
Okay, thanks. I think there was any other comment on the from the distribution subcommittee?
Dr. Stakidis, can I ask a question?
Sure.
It's Chris Callahan.
Yeah.
So for the committee, and just listening, reflecting on Mr. Cuna as well, are there some notes that, or can you help me get a feel for how your information is being pushed to forward so that we can sort of inculcate it into the planning cycle and things like that? Is there an evolution of how you see that moving forward?
Yeah, I think Chris may be able to summarize that a little bit better.
Okay.
I know the plan is to have minutes from the meetings distributed.
Oh, good. Okay.
Once we vet everything through this committee. Anything else, Chris Farrell, that is that basically the plan?
No, well, somewhat, and then mostly the meeting, the subcommittees share ideas on documents, and then we summarize the documents for the meetings that come up. Like Dr. Stakidis was reading off some of the summarized comments that members of the subgroup has met. So typically will be if the subgroup is meeting independently on their own. Sometimes they can't before some of the large groups, but if they do, then they share their thoughts on several documents, and then we summarize them for this meeting that gets presented. So
Okay. All right,
Great,
that makes sense to me.
all right, so I think next up would be Dr. Jha with opening schools, colleges, and universities safely. And thank you very much, Dr. Jha.
And Chris, before we go to that, can I ask one more question about just to the general's point? I wonder if there's another way, and maybe the subgroup can talk about it for vaccines, where we could have a little bit more interaction with the general and the work that's ongoing. So, not just through these meetings, but also some give and take, because I think it would be helpful to hear a little bit more about what's happening on the ground directly from the general, and that would help us, I think, be able to target some of the comments that we're providing as part of the subgroup. So if there's an opportunity, that would be fantastic. Thank you.
Great. Should I go ahead, Chris?
Yes, Dr. Jha, thank you.
All right. So good afternoon, everybody. And again, thank you for having me part of this. And it's a couple of things. I want to say a couple of things at a high level about where we are, and then talk about schools and colleges and how to think about them. So overall, I mean, the first thing I would say is, the state has just done a remarkable job in the last week, 10 days in terms of ramping up vaccinations. And this is exactly the right time to be doing it. We're now in the top 10 in the country in terms of % of people who've gotten their first shot. I think that's huge progress. And it's particularly important because right now is that time period where these variants that you keep hearing about, and I want to just take a minute to talk about why I'm particularly anxious about the next couple of weeks. But as these variants are circulating, we have one job and one job only, which is to vaccinate, vaccinate, vaccinate. So there are a lot of variants. You're going to hear about a lot of them. The one to pay attention to is B117. That's the variant from the UK. We think it's about 40% of all cases in Florida, 25% of all cases in Massachusetts. I don't have a precise estimate of exactly how many we have. We have some in Rhode Island, but somewhere probably in the 25-30% range would be a reasonable guess. It might be 20, but it's doubling about every 10 days. And so over the next couple of weeks, it will become the dominant force. We've talked about this at previous meetings. In every country where that's happened, you've seen a big spike in cases. I am hopeful we're going to avoid that. And one of the main ways we're going to avoid that is by doing a good job on vaccinating. And that's why I think the progress we've made in the last couple of weeks is so awesome. It's going to make a huge difference. And the only thing is, for the next 2-3 weeks, we just got to keep going. And the more high-risk people we can vaccinate, the bigger impact it will have. Look, we're going to have to keep going on vaccination for a long time. I'm not saying 3 weeks from now, we pack up our bags and go home. But I am saying the next 2-3 weeks are like super critical, because if we can get high-risk people their first shot, it's going to make a huge difference. Yeah, Mr. Mayor.
Hi, Doc. First of all, thank you again, once again. It's really an honor to have you on the same call with me. I can tell you that. I really respect you tremendously, and I watch you on television all the time. But that being said, I know you told me before, I believe you told me before, that people that are vaccinated are basically covered against the variant. Is that true? And if that is true, I want to get that out there. I think we should get that out there. So maybe perhaps more people will take us up on how important it is to get vaccinated. So if
Yeah, all the evidence we have right now is that B117 is our vaccines protect you really well against this variant. So this is the variant that's going to become dominant. It's a lot more infectious. It's a bit more deadly. And the vaccines we have, all three of them, Johnson & Johnson, Moderna, Pfizer, work fabulously well against this variant. So if you're hearing about these variants and it's making you nervous, the best thing you can do is get vaccinated.
what do you think, just a follow-up question, Chris, I don't mean to, what do you think we should do as a group here to get that message out there to the citizens of Rhode Island who may be hesitant to get the vaccination, the original shot, the first shot, to tell them how important it is that this variant comes, and this variant could be a lot stronger than the initial COVID-19. What would you suggest, Doc, that we do as a group that's, there's some 40 plus participants on this group. What would you suggest, Doctor?
Well, just talking about it here, there are a lot of folks here who have deep ties to their local communities. There are mayors here, yourself, obviously, local leaders, regional leaders, people look up to and trust. I think we all got to be evangelists for this and talk about it openly and honestly and repeatedly. I've said certainly in communities where there's a lot of distrust, working with community-based organizations, people. At the end of the day, message is important, but the messenger is maybe even more so. And we all can be different messengers for different people in different communities, and we all have to be talking about this right now. And so I'm thrilled that there's so many people on this call, and we should all be making this point. And the other part I often say to folks is, it's not just about you. It's not just about protecting yourself, which is important, but you're also protecting your family, you're protecting your friends, you're protecting your community, your neighborhood. And so even if you're like a young person, like, again, we're not vaccinating most young people yet, but you say, I'm fine, I'll be fine if I get it. But you're going to see your family, you're going to see your elderly parent or your grandparent or somebody who's high risk. So lots of good reasons to get vaccinated, not just for yourself, but for others as well.
Thank you very much, Doctor.
Absolutely.
Ashish,
Yeah.
if I might just reinforce one of the points that you were making, that is, and I know Governor McKee is the expert at this. So really what I'm doing is reinforcing it for the mayors. It's very important to tie the messaging and the actual needle in the arms together in a campaign kind of a mode. We're seeing this in other states where they've gone so far as to discuss pandemic accelerators of social justice, accelerators of equity, opportunities to actually bring the community together in a very aggressive, almost old-fashioned way. And the mayors play a critical role in this, in being present at every one of these public events and treating them as a public good feel event. One of the ways to reinforce that we're going to get out of this is to understand what we've been through, the actual timeline of what had happened to the schools and the health of the schools and of the teachers now is up on the healthcommentary.org site. And when you read that, when you read a year of activities and what happened to our schools, including the schools in Rhode Island, you realize the trauma that it's been through. So insofar as we can open up these mass immunization events in schoolhouses and other community-based areas, and you, the mayors, are there to help kind of coordinate and celebrate our recovery, that's what's going to really create momentum here, which, as Ashish mentions, that's what we need right now, momentum to get us ahead of these variants.
Great. I completely agree, Mike. And let me just say one more quick thing, and then I want to talk about schools. The good news here is we've got a lot more vaccines coming. The rest of March, supply is only going to continue to increase, certainly into April. And what I have been recommending to every state leader I've been talking to, and certainly saying it, is don't hold back supplies. Don't try to preserve doses just get them out, because there's plenty coming. The supply chains are looking good. I've been speaking to the manufacturers, speaking to folks at the White House. There's a lot more vaccine coming. And so every day when we get the shipments, we should have a strategy for getting them into people's arms as quickly as possible. And obviously that requires both trust and distribution. And I think those are really important. Let me take a minute to just talk more broadly about schools. And I want to talk a little bit about the kind of experience nationally, what we have learned. And Rhode Island, of course, as you all know, has been one of the leaders, has been highlighted. And I think we have realized as a community the importance of having schools open. And that has meant a lot of hard work on part of our teachers, and part of our educators more broadly, public health officials. But what do we know about making schools safe for kids, safe for teachers? And I think you might have heard me say this before, but one of the things I find most frustrating is often we set up this false dichotomy in between teaching kids and keeping teachers healthy. Got to do both. You can't run schools if teachers are not going to be safe and healthy in the school. So here's the kind of in general principles, and then I'll talk about why I think this applies really well to our work here in Rhode Island recently. The main things that to me are the most important based on the evidence. Number one is, of course, mask wearing in schools by kids and adults, so staff, teachers, and kids. Number two is having reasonable ventilation. You don't have to have super fancy HVAC systems, but you do need to have, you also can't have those tiny little rooms with no airflow. Those are going to be dangerous. Number three, and this is an area where I think we've got real opportunity to lead, we're already doing extraordinary stuff, is testing. I think testing in schools allows us to identify infections early, prevent significant outbreaks, and also gives us assurance that there aren't big infection cases happening. And then fourth, and this is not necessarily in order because they're all important, is vaccination and vaccinating teachers and staff. And there's a big thing with the CDC report where the CDC said, well, you don't need to vaccinate teachers. All right, but I think it makes a big difference. I think it helps a lot. I think it makes, and I say teachers, obviously I also mean staff, preschool. I'm just using that as a broader term. But there's a whole bunch of advantages of vaccinating educators early in the course. And so I've been thrilled to hear the governor really identify this relatively early in conversations that I had with him as one of his priorities. And I think it's a really smart idea. It will build confidence for the rest of this spring. Obviously, it'll be really critical when we get back to full-time in the fall. So those are the four. Now, what did I not mention? I didn't make a big deal about cleaning surfaces. Gets a lot of attention. Do you need deep cleaning? Do you take a day off? I'm just being honest, not much data that makes a big difference. So there are things that we can get distracted by, but I think if we stay focused on those four things, mask, ventilation, testing, and vaccinations, that's the general strategy. And when cities and states have done those, it has worked. Obviously, until a couple of months ago, or even until really recently, vaccination couldn't have been part of our strategy because we didn't have vaccines. Now we do. So I think it's a really important part of our strategy. But at a high level, those are the things that keep schools safe, that keep teachers safe, and allow for education to really thrive. And I just want to say one last thing. I really do think we've got in Rhode Island incredible opportunity to continue to lead the nation in this area. And so I'm thrilled to see that the governor has prioritized this. And I can talk about colleges. I've already taken up more time than I wanted, so I apologize. But very similar sets of policies on colleges and universities with a little bit of stuff. But let me stop.
If I could just add and underscore what Dr. Jha just said, I think we have an incredible opportunity to lead the nation on school safety and a full return to schooling. And one of the underappreciated things about that is that as we've talked about reopening schools, we have not meant up until now anywhere in the country full reopening of schools, which is to say no public school system of any meaningful size has all their kids back in all their buildings and all their classrooms at the same time, because generally they've observed the 6-foot social distancing rule and there just is not enough square footage to bring all your kids back to school at once under these conditions. There's a potential new blueprint for safety on the horizon, though, that would include very high rates of vaccination, comprehensive COVID testing for schools, mask wearing, hand washing, and decent ventilation, as the doctor said. As the scientific community gets consensus on that new blueprint, I think it'll be very important for this group to be able to speak in one voice about that, because I think Rhode Island has great potential to lead the nation on a full reopening of schools, to be able to say in September, we're bringing everyone back to all buildings safely. And it'll have a profound effect on kids and families if we're able to do that.
That's great. Well, thank you very much, everybody. That comes to the conclusion of the meeting. We hit 6 o'clock right here. And so want to thank everybody for coming on. Want to thank Mayor Policina, Dr. Tsoukides, Dr. Jha. Thank you so much for being speakers tonight. And I will actually follow up with each subgroup after this meeting, and we will discuss some of the documents and some of the policy and some of the procedures before the next meeting. All right.
Thanks, Chris.
All right.
Thanks, everybody.
Thank you.